So in regards to the last video, I did forget to mention that it is a good idea to go ahead and place a date label on the tubing, and the date just indicates when the tubing will need to be changed next. Yeah, anyways. And then I'm going to go ahead and demonstrate now how to insert an IV. So I have gone ahead and placed my patient in a semi-Fowler's position. I would go ahead and raise the bed up to a good working height, just so I'm not straining my own back. Since I started a new video, I would then go ahead and identify the patient. I asked for 2 patient identifiers, checking the wristband. So can you go ahead and state your name and date of birth for me?
Megan Taylor Tizar, 2/13/04.
Perfect. Thank you. And then I would just explain what I would be doing to the patient and make sure that we could proceed forward. And if she needed emotional support, let's say it was her first time getting an IV or just has a lot of anxiety with needles, I would try to create an environment where it was calm and be helpful to the patient. So anyways, I'm going to go ahead and bring all the supplies that I have gathered over to the patient. Okay. All right. So first, I would go ahead and ask the patient and make sure that she didn't have any limb restrictions, meaning that she couldn't have an IV on one arm or the other. So Megan, do you have any limb restrictions?
No.
Okay, perfect. So I go ahead and just place a waterproof towel under the patient's arm. We are going to be inserting an IV on her right arm. Okay. Before I get started looking at veins on her arm, applying the tourniquet or anything, I am going to go ahead and I'm going to open the sterile short extension tubing. I also have my saline here, which we will flush the IV once it is in place in the patient's vein. Okay, so I'm going to go ahead apply hand hygiene again, just because I did touch the cart. Okay, and I'm going to remove it from its sterile packaging. I would have gloves on. I just have a limited supply of gloves here. So when I am touching this, I would definitely use gloves. Okay. And I go ahead, and this would be my extension tubing. I would scrub the hub on the end of this with alcohol. Make sure it's clean. Don't touch it again. And then I would go ahead and insert it or screw it into the saline. So I'm just going to go ahead and tape it in place. Okay. Hopefully that sticks. Okay. And then I would go ahead and just wrap this up and place it back in the sterile packaging. I'd probably just leave it on the table in case the patient were to move or jerk when I was initiating the IV, like it wouldn't fall on the floor and then I'd have to start all over again. So just place it, set it back in the sterile packaging. Okay. And, don't want to forget, after I do this, before I place it back in the sterile packaging, I want to go ahead and prime this tubing with the saline in there. So I push it up and let the fluid flow through, the saline flow through. Again, making sure there were no air bubbles and that the line was patent. Okay, and then I would place it in the sterile packaging. Okay, and now I'm just going to go ahead and look at the patient's arm. So the patient has placed her arm below the heart level, which allows blood to flow through the arm a little bit faster, a little bit more efficiently, and makes it easier to look for and find veins. I would first start by applying a tourniquet just to identify a couple sites, possible sites for the patient. Okay, and I want to place, I want to tie it in a way, it's called like bunny ears. So you leave the 2 flaps upward and then just leave this loop at the end. So that way, when you are taking off the tourniquet, because you don't want to leave it on for more than 1 to 2 minutes, that it's really easy to do, okay? And it's not getting in the way of wherever you inserted your IV. So I would go ahead and identify a couple sites. feeling for veins. If I was having trouble, I could ask the patient to pump her arm a few times. Perfect. Just feel for them a little bit better. If I was having a really hard time, I could gently tap on the patient's arm, okay, to try to bring the vein to the surface. And I can also apply a warm compress if needed to the arm. Or I could even ask my patient to drink maybe a glass or two of water and then come back and reevaluate. Just, more hydration status equals better blood flow. Okay, so I've gone ahead and I've palpated. I'm feeling an area right here and an area right here. Possible sites. Let's say if I couldn't get it in this one, it's always good to have a backup. Okay. So I'm just going to go ahead and remove that tourniquet. Okay, before I begin, I'm going to, again, apply hand hygiene. Okay, and then put on clean gloves. I also, this would be the sterile transparent tape that I place over the catheter once I had it inserted into the vein. Okay, and I'm just going to go ahead and remove that. And I would also label it too, just with the patient's, the name, the date it was inserted. I could also even state the size of the catheter used. Okay. So go ahead and apply clean gloves. Okay. And again, I would go ahead and take my alcohol. I would reapply the tourniquet. I already have my sites. Okay, so I've applied my tourniquet, looking at the patient's arm. Okay, just kind of feel the vein right there, which is where I want to go. All right, and I'm going to go ahead and I'm using alcohol, so I'm going to rub in a circular motion around that area. Okay, and allow that to air dry and don't touch it again. Okay, I would then go ahead and take the needle out of the sterile packaging. Okay, and I am going to kind of bring the saline and the essential tubing to a better location. So again, you don't want to leave the tourniquet on for more than 1 to 2 minutes. So I have my needle here, and I'm going to make sure that the bevel is pointed upward, and I'm going to angle it at a degree of 10 to 15 degrees. Okay, and again, I felt for that vein. I know that it's right there. I'm holding this with my dominant hand, and I'm pulling the skin taut with my non-dominant hand, and I'm going to go ahead and insert that IV. Okay, so usually you'll feel resistance once it is in the vein. You'll feel resistance once it is in the vein, okay, and you want to go ahead and stabilize that, okay, and then you're going to reach over and you're going to grab your saline, okay, and you're going to flush that line, checking for any infiltration at that site, because if there was infiltration, you would have to take out that IV, okay? And then just make sure you're stabilizing that with your non-dominant hand. So there was no infiltration at that site. And then I would go ahead and I would place a sterile dressing over that, okay, to stabilize that. All right. And then I would then go ahead and release the tourniquet, okay, and then release the needle from that, and then take it to the sharp. So we're just going to leave that in like that. Okay, I would then make sure the patient was comfortable. Are you comfortable?
Definitely.
Okay, I would then lower the bed down to a good working height. All right, lower the bed down, okay, and made sure the patient's call light was in reach. I would then discard all of my supplies, and then I would go ahead and document. So I would document the date and the time that I inserted the IV. I would state that, you know, the bed has been returned to the lowest position, the bed is locked, the patient doesn't have any complaints, has no complaints, there was no infiltration at the IV site, no redness, and that I did inform the patient to notify one of us if they were having issues at the IV site. And that's it.